I'm Stefanie de Deurwaardere and I'm Head of Epilepsy Discovery Research at UCB. One of the key points for UCB's epilepsy strategy is really a deep understanding of patients with epilepsy. So we want to be the company that understands their patients the best. So this is on a day-to-day basis, what does it mean to live with a disease like epilepsy? What are the unmet medical needs? What do our treatments have to achieve? So on the one side, it's really the patient-centric focus. On the other side, it's also about the biology of their disease. We want to have a deep understanding on what is it that causes epilepsy, what are these pathways, mechanisms that are leading to this disease. So one of the key things in our research at UCB is really, as I said before, is to understand the disease biology. And it's important because we want to move away from purely thinking about symptoms and seizures and redefining the patient populations according to mechanisms, a bit similar to oncology. But to understand those mechanisms, to understand what pathways, what changes are happening. So partnerships are very important for UCB. As I mentioned, we really want to be very well integrated within the ecosystem. And so we don't only want to do things internally, but understand, appreciate that working together with the field, with the community, with academic partners, with biotech is going to be beneficial for all parties. And so we are having those kind of collaborations on multiple fronts, from the very kind of preliminary basic research, and this is where partnerships are there with academic centers on the brain samples, on studying those brain samples and understanding the molecular biology. And lastly, also, we are working on new drug discovery programs. And one example is KCNT1 associated epilepsies, for which we are collaborating. So digital innovation, I think, is really happening on a lot of different fronts. Clearly, the patients can use it to better understand their own disease. I mean, that's what we're all doing in daily life, kind of track our sleep or our activity, and I think it can really help them to get better insights in this aspect. Also in the research labs, we are really using a lot of digitalization in the lab work. Technologies can help. As I said, talked about sequencing. This is something that scientists had to do months in the lab to get, and now it can be done almost overnight. I think also these days there's a lot of hype about artificial intelligence and what does it mean, and will it replace us? And I'm seeing it more on the optimistic, positive side. I think for me it's not like should we use it? Yes, we should use it, but we need to learn how to use it. Fast forwarding to the future, 10 years time, like what will have happened? So I think there will be a couple of things that I hope for. So one is on our chronic medicines, our anti-seizure medicines. I mean, UCB also wants to increase access to patients and wants to make it more available, additional markets. So I think that would be a great achievement if we could have people that currently don't have access, provide access and make sure, treatments are there, right? So they should be able to benefit from it. That would be amazing. And of course, I wouldn't be a scientist if I also wanted some of our work that we are doing in discovery to pan out. So, if we can get that first disease-modifying treatment into the clinic and seeing the results of that, that would be a bright future for me.